Hi, welcome to In the Nose Gut Check. I am your host, Arielle Simone, a certified nutritionist, and today we're going to talk about skin and gut health, from breakouts to acne to just not feeling well with your skin. We're going to meet up with Dr. Dibba to get clear on how we should be eating and living for better, glowing, clear skin. So let's go, y'all. Hi, Dr. Dibba. Thank you for joining us again.
Absolutely, Arielle. It's my pleasure to be here.
So what is the link between gut health and skin health? How are the two related? What's their relationship like?
It's actually multifactorial. You have instances where there's an actual pathologic process going on in the gut that manifests as skin disease. Then you have the effect of the diet on how that manifests in your skin. And then thirdly, there's this concept of food allergies, and that can be inclusive of the skin and the gut.
Oh, that makes a lot of sense. So how we eat, does it affect the way our skin looks and how it feels?
Absolutely. A lot of the foods that we eat contain a lot of nutrients that are important building blocks for our skin. So very often, you might speak to a dermatologist who might recommend foods that are nutrient dense. So a lot of fruits, vegetables, whole grains, healthy fats that really contain the building blocks that maintain the integrity of our skin. So things like vitamin A, vitamin C, B, D, E.
So that kind of sounds like we want to glow from the inside out.
100%, absolutely.
I love that. Is it true that certain foods can cause us acne, or is that more of a myth?
That's so interesting that you bring up that topic, because this has been controversial for many years. There never was a very clear link between diet and acne, but recently there was a study that was published in over 24,000 adults. It was survey-based, and essentially an association was found between diets that are high in fat and high in sugar and acne. Now, it's important to consider, though, that this is an association and not necessarily causation. So this study didn't show that diets that are high in fat or high in sugar absolutely cause acne. And this study also did not prove whether elimination of these sorts of diets actually reduce the incidence of acne. That being said, I think it's very valuable information, and it's something that can be discussed with a dermatologist if you are being treated for acne.
When it comes to food intolerances or allergies, do we start with the gut or do we start with the skin?
So it really depends on your manifestation. I'm actually glad you brought that up, because when it comes to food allergies that manifest as skin changes, you might notice rash, hives, etc., and this might not necessarily be related to the gut. When it comes to food allergies with respect to gut symptoms, it's a completely different kind of scenario. That might manifest as nausea, diarrhea, rectal bleeding, failure to thrive, and may or may not have skin changes.
So what about dandruff or eczema or psoriasis? Does gut health play a role into those conditions at all?
Actually, there is some data to suggest that perhaps dietary changes can help in management of these diseases, but not necessarily that they are triggering the diseases. That being said, I think discussing this with your dermatologist to be 100% sure that you're covering all bases for your management plan in terms of treating your underlying condition, this would be a valid point to bring up.
Okay, so it sounds like, generally speaking, we should go to a dermatologist if we start noticing certain skin flare-ups, but then after that, then we go to you?
Yeah, a dermatologist can really identify some of the lesions that are specific to gut illnesses and then send them over to our way so we can kind of do our workup.
Oh, okay, that's nice. So it sounds like it's a team effort.
Absolutely.
Thank you so much for joining us today. I feel like I have a better idea on how the skin and the gut is related and just how they work together.
Absolutely. It was my pleasure to join again, and good to see you again.
Yeah, thank you.